You've already heard Flavia introduced as the Assistant Director General, which she is for the Family, Women and Children's Health at WHO. And she was the previous director of the Partnership for Maternal Newborn Child Health, and in fact, one of the architects behind PMNCH. PMNCH, for those of you who don't know, actually came about as a bit of a forced marriage in 2005 in Delhi. And Flavia had worked behind the scenes to try and get those communities to come together for greater impact. And this really speaks to what Flavia is all about. She is very much a collaborator. She is a future-oriented strategic thinker, and she has a way of getting to yes. In 2010, actually 2009, but I worked with Flavia, and then in 2010, she was actually present when the Canadian then network, now Partnership for Maternal Newborn Child Health, formed. She was the only non-Canadian in the room at the time. And so we worked together on the G8 Canada Muskoka Initiative, and I also worked with her on the UN Global Strategy in 2010, which is where the getting to yes comes from, because the timeline she gave me was completely ridiculous. Can you do this in 8 weeks? So anyway, without further ado, Flavia is going to get you all to yes. Thank you, Flavia.
Thank you so much. She told me I'm going to say something provocative, so I was prepared. But before I go into the substance of my little provocation and talk at the beginning of this afternoon, I want to say how proud I feel, having been at that point the only non-Canadian that was part of the discussion of whether or not there should be a Canadian partnership that would deal with maternal and child health. And I still remember at that time the Minister for Development, she asked me, what do you think? Is it a good idea? And I said, it's a wonderful idea, Minister. Go, go, go. And here we see the fruit. So I really feel proud. And I want to thank Helen and you and Rosemary, that now is closer to us in Geneva, for having spearheaded that and having created the space that now is ready to drive one more time for really the health and well-being of the ones that are furthest left behind. And I sincerely meant it yesterday when I said that we are here for history. I've seen the power of these groups that here in Canada can actually operate to transform the action in the world, not just in Canada. You talked about how much in Canada in your lifetime, how much that has changed, but also in the rest of the world. So the topic, the title of my talk is Healthy Adolescents and Thriving Societies. And let me say why I thought it's so important that we do not have a title that is only about health and healthy adolescents. And it's because I feel at this moment in time, after the agreement on the Sustainable Development Goals, all the conversations that have been part in the last year in the Italian-led G7 and the G20 conversations that are happening, in the conversation in the African Union, this link, health and thriving society, is the link that is being discussed and is where our message can resonate so powerfully. So this is a brief outline of what I'm going to cover, the adolescent health and the Ottawa Charter, because in order to look forward, we also need to look backward, where we came as a Canadian partnership, but also some years back. Also, think about what were the missed opportunities in the past and why were we not able to make the case sufficiently for adolescent health. Reflect on the unprecedented opportunity that we have today, think about the key implementation mechanism, and maybe they're not all. I know even during the day and the conversation we have had, some other mechanisms have emerged, but also think about next frontier. So I know last week, actually, you had a very interesting public health meeting here in Ottawa that was reminiscing and conversing about the Ottawa Charter. And to me, I think this, in my thoughts, this is really what linked to the title of the speech. Health is a resource for everyday life. That's what Ottawa Charter, and one of the key ideas and thinking that came actually from here, from the group of partners and players that met here in 1986. So it's a little more than 30 years ago. But this concept that health is a resource for everyday life originated here and can be so powerful and resonating today. Now, why did we miss opportunity in the past? And I know there is Professor Patton and many others that sometimes they were feeling very, very impatient that we were not advancing on adolescent health. But one of the reasons why we missed was that we had historically big data gap on adolescent health and adolescent needs. Also, I remember very well in those days when we were creating the Partnership for Maternal, Newborn and Child Health that you mentioned, there was a sense that, well, adolescents are healthy and therefore they don't need special health services. This is not a big priority. And also, there was a mischaracterization that, well, adolescent is a difficult time and the public health services, we better not get involved. It's all about sex, drugs, and violence, and those topics, they are divisive, so it's better we stick to other topics. And therefore, as we have started our conversation, adolescent health has been severely missing in global health, in the development plan of countries, and definitely in the investments. But we have unprecedented opportunity today. I truly believe that this is the case. And I go through why I believe that we have unprecedented opportunities: the political commitment, the scientific knowledge for multi-sectoral action. We launched yesterday the framework. We have more knowledge about the investment that is required and what the investments will pay off. I also think we have much more knowledge and much more help from the human rights framework. And most importantly, we have a resource that we did not have 25 years ago, which is adolescent leadership, young people leadership, their voice, their strong voice that is making the case for innovation and for participation very, very strong. So political commitment, I think we referred already quite significantly. It was one of the key change when we worked with the Secretary General to agree the global strategy for women, children, and adolescents. The adolescent was the part that was new, and that was the part that even, strong leader like the Secretary General thought that was important and very important to address. And so this is in the title. But also, last year, I want to remind particularly the young people and the ones that are not in the inner policy circle, we had a resolution by all the 194 members of the World Health Organization that looked at the strategy, which include adolescent health, and committed to take action on it. So this had never happened. It's in the scale that we never had before. We also have, and we have discussed it yesterday, and I know today also we have dig deeper, but the level of scientific knowledge for multi-sectoral action in health, in the other sectors for addressing adolescent health, has grown dramatically. And here, of course, I want to have a special thanks to the Lancet Commission, all the members of that commission, George Patton, that I think is still in the audience, Zulfikar Bhutta, and many of the colleagues that have worked to make sure that this knowledge we have is much stronger, much deeper, and is captured, particularly in the adolescent framework, in the how how do we translate that knowledge into the actions that can change life of adolescents? And we also have far clearer knowledge of adolescent deaths, the causes of deaths. We have also done analysis, and in the last 2 years, a lot more has emerged in terms of the difference of causes of death by gender, also by young adolescents versus older adolescents. So we have tried to dig deeper on what are the causes of their ill health. And one thing also we have overcome, and I can tell you this as my role at the World Health Organization, I always have the groups, particularly the reproductive health group and the adolescent group, there is always that tension there. Maternal causes, maternal deaths, unsafe abortion is an important cause, particularly for adolescent girls of the older age group, but also we have found the balance, looking at the other conditions that are important, and across all boys and girls, and across all age groups, I think one key message which we have discussed yesterday is that mental health is a critical issue. It's a critical issue not only because it's a critical cause of death, but also because 50% of the mental health conditions start when you are 14, 15. And if you look at a little bit later, when up to 24, that accrue for 75% of the mental health condition. So these issues has come to the fore in a way that we hadn't really appreciated and we hadn't really discussed before. So unprecedented opportunity for our work on adolescent health with adolescents also have come from the results that were published and appeared this year in the Lancet, again, that makes a strong investment case of the benefit-cost ratio of investments in adolescent health of more than 10. And this makes the case that there are very strong economic and social benefits and social returns for investments, for example, in preventing road accidents, on the physical, mental, and sexual health of adolescents, on the secondary schooling, on preventing child marriage, and creating the conditions for prevention of violence. So the investment case that was developed and presented, please note again, is focused on health, but is not only about health. It's about how health is instrumental to make those adolescents part of a thriving society. Now, one aspect that is an opportunity, but is also a frontier in the way I see it, is that we still have limited knowledge and limited ability to track the investment that different governments are making on adolescent health. And here, this is another very recent publication that has appeared by the work of the Norwegian Institute for Public Health and the International and IHME that looks at the spending on development assistance. And I think we need to do more to disaggregate what is the investment that development assistance is making on health of adolescents. But even more important than the development assistance, we need to do more to understand what the domestic investments that countries are making. And how is India investment being made? How is it growing? And track that, because that, in a very, very simple sentence, follow the money. We need to be able as a community to follow the money. Is this investment being made, and does it have impact? So, human rights. I think you have heard me speak about this topic for long, but I just want to give one additional opportunity that I see coming. We have worked with a very distinguished group of high-level individuals in a working group that was looking at the health and human rights of women, children, and adolescents. And this very particular report and this recommendation will be presented next week at the World Health Organization, the first day with participation of President Alone and the chair of this group. And by the way, Minister Bibo Honorable Minister was also a member of this high-level working group. And the reason I raise this as an opportunity is because this is one report and some recommendations that really speak to the indivisibility of rights. So we talk about the right to health that all individuals have, but it also talk about the rights through health. And by that, what is meant is that unless you are able to enjoy other rights, for example, freedom, for example, education, for example, income, you cannot have really health. So this indivisibility of rights is an additional argument that can help us in making the case for adolescents. And the leadership and innovation. And now, Gigi, I think you know that where I'm coming here is like for the last few years, every time we have discussed this, the words that remained in my mind were nothing about us without us. And I think this energy, truly significant energy that is coming to this community and this come also here in the Canadian partnership is something unprecedented, and it's really transformative and can also help us benefit from the innovation, from the communication, the rapid communication through social media that really adolescent leadership and young people leadership and participation is making. And one aspect that we will discuss a little bit more this afternoon, and I know there is a particular session about it, is Young Voices Count. So capturing that experience, what is it to grow up as adolescent during the Sustainable Development Goals, maybe different than growing up as adolescent as you had here in Canada, but capturing that and getting to know the needs from adolescent themselves. This is quite a unique opportunity. Now, the implementation mechanism we have. I mentioned that we have now a strong commitment from the Ministers of Health. We also have a partnership of the United Nations agencies, the H6, to translate these ideas really in country implementation, use this framework that we had launched yesterday together and translate it into action. And also we have an unprecedented opportunity of the Global Financing Facility, and I know this morning we discussed that. How do we get additional financing? And of course we have a multi-stakeholder partnership like the Partnership for Maternal, Newborn and Child Health and the movement around Every Woman, Every Child. These are all instruments and really mechanisms that we have to capitalize and move on. I think what I call next frontier here is we still have to do more work on country data and information system. Because as you remember when I said, what is it that was hampering our ability to make the case for adolescents? That was data, that was knowledge. So we still need to have a better country data and information system, work more on indicators for tracking progress on adolescent health. We need to track the investments, as I argued. We also need to have further and stronger knowledge on country implementation, focus on innovation for the transformation, and work with the young voices and make them count. That's all I had to say for this early afternoon, but please remember, you are here to make history, not just to participate to a conference, but to make history, and I am really proud that we will have this chance to make it together. Thank you, Ellen, thank you.